boys and girls. I am Suneeta Mukherjee and I have come to you from Gurgaon to this beautiful city of lakes to talk on a very critical subject. Our burgeoning young population. Is it a demographic liability or can it be a demographic dividend? But who are these young, what is this young population? Who are these young people we are talking of? We all have young people at home. We all have had some experience with them, some interesting experience. I'm going to share my experience with my son, Rajat Mukherjee, when he was an adolescent. So I was posted as UNFP representative in Sri Lanka when Rajat left Dul School and came to join me to do International Baccalaureate Diploma, which was not available in India. He had made up his mind to join Royal College of Veterinary Surgeons in London. There was no internet and all, and I don't know how he got all this information. And suddenly I was told he's coming to Sri Lanka. I was thrilled, but when he came, I found him completely changed. He was withdrawn. And he came, he stayed in his room, he rarely came out. The room was usually dark. If I went in, he would startle and ask, what do you want? He would only put on the light to study or sometimes carry his dinner plate to his room and eat there. So from the child who would run from school, hug me and tell me everything that happened in school, you know, and that happened during his bus journey, suddenly he was a complete recluse. He pierced his lower lip and upper eyebrow. When I asked him why, he said, I was bored. Things started getting worse and he started going out at night. I one day heard a click of a gate and I ran out. I ran out with my Doberman and with my guard, but he just disappeared in the thin air. This was repeated off and on, and I asked him one day, raised my hand, I will hit you if you don't tell me. I said, I'll call the police, hit me and see. So that's what they taught him in school probably, you know. I called the police. It was a British school, so probably they were talking of extreme cases. But anyway, now this going out at night became more frequent and started happening daily. I wondered, was he taking drugs? Was he gambling? Or worse situation, was he going to sex workers? To everything he answered, no, I'm only seeing friends. Anyway, I consulted counselors, I even cut his hair and sent it to a lab because he wouldn't go in for a blood test to check his drug levels, but it was inconclusive, the test was inconclusive. Anyway, one day he finally confided in me and said he was going to see a girl whose parents had forbidden her from meeting him. So he would go, after she would ring up and say that everybody is asleep, you can come now, he would go and take a photo and go, he would sit outside her window, talk to her. I looked at him in disbelief, how can that be true? He was just coming back from her early morning when I met him. And he moved from his pocket Odomos. See, she threw me this Odomos because mosquitoes were biting. So that was what Rajat was doing. And when I talked to my husband said, his adolescence never goes. It keeps on. When will it go? He said, I never had adolescence. I didn't face any adolescence. My husband studied in a military school, RIFC. So you can imagine. He said, I never knew anything like adolescence. So that is Rajat Mukherjee for you now at age 42. He's the most respectable, honorable person. He's a vet in a hospital in Barnet. And he studied in London, what he planned, and he works there. He is the most wonderful person I know of today. But this is what adolescence is. My husband says, give them the right values and they'll be fine. Adolescence is a period of transition when you move from childhood towards adulthood. It is accompanied by a lot of hormonal changes taking place in your body. And this is the reason that children like to take so many risks at this age, experiment at this age, because they have an adrenal rush. Now, UN defines adolescence by age group 10 to 19 and youth as 15 to 24. Many of you girls will be familiar, you will be in this age group and you will understand why you sometimes feel a hormonal rush and suddenly want to do certain things. Young people between the age of 15 and 24, youth is also 15 and 24. This definition is not standard, it's a UN definition, and India takes it youth to the age 29. So what are we doing here, old people? Can you give us indulgence and look at us, at least for today, as recycled teenagers, recycled young people? So that's the recycling. Now, why are we looking at young people so much? Because we have large numbers of young people. 50% of our population is below the age of 25. So, as per UNFPA has done a research, UNFPA, they have done a research and said we are going through a demographic bonus. This is a bonus window we have got from 2005 to 2055. 50 years our population will continue to increase. And this will happen mainly in 5 states, Madhya Pradesh, Bihar, Uttar Pradesh, Rajasthan and Jharkhand. And this will happen over different times, like 5 years here, 10 years here, 10 years here. What will happen with that? We have an opportunity to utilize this population in states where labor is short, like Kerala, Gujarat, Tamil Nadu, and places, or in Western countries where labor is short. Then what is the challenge? The challenge is that this labor, these children have to be skilled, keeping in view the needs of the next 20-30 years. We have to anticipate the market needs in other countries as well as our country. Things are fast changing and accordingly train them. I'm going to explain this with a population pyramid. I'm sorry, this is a little heavy. But you see, I'm going to show you 1991, 2021 and 2036. In 1991, this is a typical population pyramid. That many people are getting born and less people reach the top. Right? This is a typical population pyramid. 1991. Now let's look at this pyramid. This is today. We have a large young population, adolescent and youth. And look at our pyramid. Now this all becomes working population. China also had a large working population which they use to boost their economy. After one child policy, however, this is what they will do. So China will also be short of manpower. And look at Japan. Japan is now using people in the age of 60 and 70 in their workforce. So this is how the situation will be, and this is why we make our country go ahead and become, this is really a demographic window of opportunity, and we must not let it pass. This is the opportunity for all of us also to become superheroes and contribute towards this. Now, what are the challenges? Why is it that we are unsure about? Why is there a question mark? Let's take challenges in 3 areas: health, education and employment. Why health? WHO says that 70% of diseases in later years can be traced to adolescence. Look at the economic, socio-economic conditions. People who live in poverty, with poor health, poor sanitation, bad water, not safe drinking water, toilets, all these people, and poor quality of food, making them anemic. I mean, how do they come up and become healthy people ready to work? Because young people like to take risks, we find a large number of substance users, 13% below the age 20. Similarly, we don't educate our young children in matters of sex. Teachers are embarrassed as well as students are embarrassed. I know the teachers here are different, but generally in schools, especially government schools, teachers will tell you read the chapter at home. Now it is very important as parents and teachers, we educate the children about matters of sex in a scientific manner and tell them about safe sex. If they are, the first message of course is do not have sex till you are of a certain age ready for it. But if you are going to, then have safe sex. At least it will avoid this AIDS burden. Look at the AIDS burden, 31% between 15 and 29 years. So very large people still have AIDS. Then since these children are very disappointed, they also have mental problems. So suicide is the third leading cause of death in 15 to 19 years old. 35% suicide. Let us look at education. We can boast of the largest education system in the world. But first let's look at gender equality. India is 127 out of 146 countries in gender equality. This is according to World Economic Forum. Can you imagine? We are below all our neighboring countries except Pakistan and maybe Afghanistan. We are below. Bangladesh is at 56. We are at 127. Even China is better than us. Look at Nepal, Maldives, Sri Lanka, Bhutan. And this is because of all our cases of rape, dowry deaths, molestation, kidnapping, trafficking, robbery, snatching. The situation is very bad. I don't know how we can all contribute to this, but each one can do a little bit, and we are hoping the government and civil society continue in their efforts. Now, education. While we boast of the largest education system in the world, largest number of schools, over a lakh, large number of teachers, much larger number of teachers. Our quality of education suffers, especially in rural areas. So according to Department of Health themselves, their report, 31% of children of class 8 couldn't read class 2 textbooks or solve the maths problem. This is a sad situation, because what is this kind of education? Teachers aren't trained, and we lack things like digital literacy, sports, and other infrastructure facilities. Employment. The basic problem in employment is a skill mismatch. Children, young people are dying to get jobs. They are educated and trained and waiting to get jobs. Industry is looking for workers. These young people are saying we are here. Industry is saying no, we are looking for some other kind of worker. So there is a skill mismatch, and we must have a matching skills to be able to go forward. Is then all lost? No, all is not lost, because we have certain triumphs. What are our triumphs? United Nations has congratulated us because India has removed poverty and for 415 million people. It's a different question what poverty norms are we using. But 415 million people have come out of poverty in 2021, and now our poverty is below 15%. It used to be 55%. It is now below 15%. It is very, very difficult to reduce maternal mortality ratio, because one death occurs here, one death occurs there, one death occurs there. And it's very difficult to correlate everything. But government has made huge efforts, and in the rural health mission, as well as in its coordinated mission, and with the field staff, some of them which they introduced, like ANMs were already there, but they introduced ASHA. Maternal mortality ratio has decreased to below 100. This was a statement made by Minister in the Parliament this year. I was working in Health Ministry. I never thought I would see this day. It was so difficult. And I am so happy to share with you, because I firmly believe that a mother who brings life to this world should not die before death can be prevented. We must try and prevent her death. And girls are finally equal to boys in higher secondary. We had already achieved 100% primary education, but now secondary levels have gone up. However, there is a long way to go. We are not even at 60%. Child marriages have reduced. The new education policy brings us a lot of things. It works on inclusiveness and merges all the education modules. It is more comprehensive and will introduce vocational training from class 6. It also looks after basic education even before primary level. In the Skill India mission, government has trained 61.5 million children. These children are being trained with the industry. Like if 15 people are placed with Maruti, it is expected that Maruti will train them and employ them. However, employment is not happening fully, and that is being addressed by the government. They have also trained 7 lakh apprentices And they have done a survey of the world market. They have identified 16 countries and they have signed MOUs with 11 countries. They are setting up international skilling centers there, where many, I hope some of you will go and get trained. There are over 90,000 startups which start in young missions, and in this there are 100 unicorns. This figure, even I am very impressed with. 100 unicorns is very good. Now I am going to tell you another story, because I felt that my presentation is full of data and would not be as interesting as a Superman or my succeeding thing. So this gentleman is an upstart religious leader, trying to be a religious leader. And sorry, picture is not very clear. And he has a bird in his hand. Now this is public in Kullu. I come from Himachal. I have worked in Himachal Pradesh. There was a Dasera festival, and they take all the temples, deities in a procession. Now they had come back and the religious leader had announced that next year there will be somebody else, I am retired. So while there was a whole chain of hierarchy for successors, this gentleman came up and said, I am the smartest and you must take me. So people are saying, Babaji, wo kuch jadoo usne kiya, kuch produced kiya. Then he had produced a bird, and now the bird is behind him. And now he's saying, tell me if the bird is dead or alive. Now he felt that if they say dead, he'll make it fly, it is alive. And if they say it's alive, then he'll just kill it then, twist the neck and say, see, it's dead. So, I mean, he thought he will get this thing. So the man who was retiring, everybody asked him that you say something. He told him, old man, the answer is in your hands. So I want to tell you all, the answer to whether our young people will become a demographic liability or become a demographic asset is in all our hands. We have to all work for it. I am supporting a few children, 10 to 12, in studying after class 12 in memory of my husband, Suneeta Mukherjee, who was very keen to support education. I am sure all of us can do our little bit. Government and NGOs can do our little bit. And become supermen. We have a mission. We cannot fail our nation like we cannot fail in climate change. We cannot fail our young people. We have a mission. This is an adaptation of a Chinese poem. Perhaps these thoughts of ours will never find an audience. Perhaps the candles we light one at a time will be blown out at a time, one at a time. But perhaps when we shed tears for others, the earth will be more fertile. Perhaps we have no choice. We are driven by a sense of mission. And our mission is to ensure that our burgeoning population is a demographic asset. This is a window of opportunity.